First, I would like to ask all your permission to use this video for educational purpose and on the internet.
Sure can.
Okay, thank you. Now, looking at you, it's really hard to tell who had the surgery. But would you mind to raise your hand if you had a surgery? And what may I ask first with you? What kind of surgery did you have?
I had the OLLIF L4, L5
When did you have the surgery?
yesterday morning.
Yesterday morning. Now, and you are in the Inspired Spine Concierge. And may I ask you, what did you have?
I had the OLLIF L3, 4, 5.
So two-level fusion. So one level and two-level fusion. By the way, are you guys enjoying the concierge here?
It's very nice here.
Yeah, it is. It is supposed to be a healing place. Okay,
That's right.
a quiet and healing place. Now, the surgery is less than a day.
Right.
Do you guys feel ready to go home?
I actually do.
Yeah.
Yep.
When did you start walking?
Right after.
Right after. What about you?
Yeah, I walked right after, not very long. This
Yeah,
morning is
yeah,
better.
better. Now, we talked about that you know, obviously the surgery, we put a tremendous amount of metal in you to get the surgery done.
Yep.
And so sometimes, you know, people feel that, and so the back pain is normal. I would be surprised if you don't have that. But tell me, maybe we start with you.
Yep.
Symptoms in your legs before the surgery and symptoms in the legs now.
So the shot really helped. But 3 weeks ago it started where my leg was numb all the time. Front, right in here, and my butt. My butt. Excuse me. But now that's completely gone.
That's less than a day after surgery. When did you notice that's gone?
This morning.
Yeah. What about you?
Yeah, I
Before
had
and after?
numbness on the side of my leg and my two toes, and they're not numb.
Well, the specific reason I'm asking this question is because many of my colleagues, they say the only way to make that leg symptoms to go away is cutting the bone. I tell the Lord put that bone there for a reason. If it's first of all, it's very invasive to take it off, and this is just to show you don't have to take the bone away.
That's right.
And what I did, I just restored the height of this.
Right.
That's all I did, and it took me less than 10 minutes to do that.
Wow.
Yeah, and your blood loss was about 60 cc, which is about 2 ounces. Your blood loss was 12 cc, meaning about 2 spoonfuls. Even though you had a 2 level and you had a 1 level, sometimes it's nothing unusual. There's nothing unusual about that. Now, may I ask you, before the surgery, what were your symptoms?
Numbness in my leg, my right leg, and severe back pain in my back.
Okay, how long did you have it?
Like 3 years.
3 years?
Yep.
How were you treated in that 3 years?
I just had to I did physical therapy and lots of core muscle strength.
Mhm.
But, and it did help with the shot. It helped, but it did not, I'd have my days where I'd be hunched over, having a hard time walking, getting up out of chairs, in and out of chairs.
Yeah.
Very uncomfortable in a lot of chairs. If I'd sit down, I was always uncomfortable having to adjust or move or
Yeah.
whatever.
And may I ask you what your symptoms were before the surgery?
Yeah, so pretty bad back pain and
Mm-hmm.
the numbness down my leg. I've had a bad back for like 20 years, but it kind of came and went. The last year or two, it was just constant.
Yeah. No, the back pain is very common but for people who don't have that, they don't understand how vicious that can be. I have myself back pain, so I know how it is when it takes you 15 minutes to get in and out of car. Okay. Now, how did you treat that before the surgery? The pain.
Physical therapy, mostly some core strengthening. I went to a back rehab class,
Mm-hmm.
and it would help a little bit, and then it would just, or sometimes it didn't help. The last 2 years, it flared it up every
Yeah.
time I tried to do therapy.
No, you're coming a long way to us. You don't live around here. That's why you're in the concierge.
Yeah.
Why did you decide to come to us?
Well, 20 years ago, I saw Dr. Is it Sunny or Dr. Kim?
Yeah,
I
yeah.
saw him.
You
So
don't
I
need to
kinda
say any
knew-
names generally,
I'm sorry,
but
yeah.
don't worry, don't worry.
I saw a doctor here, so I kind of knew about the clinic when, and then I did some research online, typed some stuff in, and you guys came up.
Yeah. What about you? How did you decide
So
come to us?
I found a video on YouTube,
Mm-hmm.
and 2 guys, and I forget their names, but we're doing an interview with you. And beforehand, I had gone to the conventional hospital to see what they suggested, and they said that they would do the whole thing where they would fillet my back open,
Mhm.
go in and cut the bone away, and then put some screws and hardware in, and then I would be in recovery for a year.
Yeah. What I'm sure both of you did your research before you came to us.
Yep.
Did you have a good comparison between what we are doing
Yes.
and what other people are doing?
Yep.
Like blood loss in our surgery
Right.
is 1/10 of the open surgery. Hospital stay is 1/4 to 1/3 of the open surgery. Recovery is 1/2 to 1/4 of the open surgery. I'm sure you did those research
Yeah.
yourself, right?
Yep.
Did you have
Scared
it?
me.
Did you?
The conventional way at the hospital scared
Yeah.
me. I'm like, I am not doing that.
Yeah, you would be still in the hospital. You wouldn't be here. Now, having said that, did you listen to people who have done that? Like this will be online. Did you listen to people like yourself
Yes.
on our
I
YouTube?
did, yep,
Yes.
on YouTube.
Were,
Yep.
were they helpful to you?
Yes,
Yeah.
very much so.
Put you at
Yep.
ease a
I
little.
probably
bit,
wouldn't be here if I didn't have those videos.
Yeah, yeah. Now, what do you think? For future patient, if you go back in time to yourself, you're struggling with this for so many years. What advice would you give yourself?
Hey, come here first.
No, thank you. Very nice of you.
Right. I would say that this is really a groundbreaking technology that you developed, and it makes it doable.
Yeah,
The other doctors said 50-50 chance that it would even work.
yeah.
When I came here, you guys said 90% chance that it would work.
Yeah, we have a statistic. With 10 years, we have gathered our data in a database that, by the way, I wrote myself. And I critically gather those data, we put it in, we analyze them every month. So this is not gut feeling. This is working. And my advice to everybody is, go out, look, there's something called Google.
Yeah.
You can get the information. This is 2023. My advice is, to go out and get the information. And if a doctor try to not give you information, or even worse, give you information in a way you don't understand, there are other doctors around. I think a good doctor knows how to give you the information the way you understand. That's my advice for every patient. Well, I'm hoping this will help some other patient in this
Right.
process. So I really thank you. This is a good community work what you are doing right now. I really appreciate that.
Amen.
Okay,
Yep.
thank you very much. Okay, thank you.